Yeah. And that brings up one question is the a follow-up question I have is a lot of what sort of problems or frustrations or aspirations do hospital employees have when it comes compared to other industries when they come for group coaching?
Actually, it's one of the reasons I also really the healthcare is that you have this group of wildly educated people, very well trained, very knowledgeable, very smart experts, top of their usually top of their game, right? Because there just are only so many doctors, only so many nurses, only so many dentists, all this stuff. Okay, the flip side is though they've received zero management training. So they may have received training on bedside manner stuff, but there's no training on how to solve difficult problems, how to have difficult conversations, what happens when there's a conflict, what happens when there's a safety concern. Why are we still having a hierarchy in hospitals? That's a culture I have. There are all these like questions and things are very different in hospitals that are in the rest of the world. Like if you worked at like craft, I guarantee you, I'm just making this up, but I would imagine they're spending at least $2,000 a person, at least, on management training and presentation training, how to work with colleagues, how to work across, how to work down, how to work up. Like that, in these big Fortune 500 companies, management training is like daily. It's very common and it's like in the DNA. And I just think that that's a big disadvantage that healthcare has that it would really help them because let's say I like the hierarchical stuff makes a lot of sense if you're in the operating room, right? There needs to be one person making decisions, otherwise it's chaos. Fine. But that ends when you walk out, you're still dealing with a bunch of humans who have opinions and ideas. And it's hard, right? It's hard to work with people who have see things differently than you. And so that's what kind of life is. And there's no, I like to call it like no policeman, like there's no like enforcer of the mores or a lot of the mores in hospitals, right? There's like different groups and they have different opinions on how things should be done. And they have a way that they work together, they make it work. But if there's not great skills in negotiating problems or figuring out solutions, you could end up with a very toxic environment. And because maybe someone doesn't want to deal with somebody, so they just ignore them. And guess what? You know what that leads to is higher mistakes, lower patient happiness, or all the different metrics.